The holidays are right around the corner, which brings wonderful opportunities to reconnect and spend quality time with family and friends. Between all the festivities, travel, and festive gatherings, this season can also create ideal conditions for viruses not only ruin your plans, but also spread to those we love. Now, joining us this morning with more information on how to stay protected this holiday season is Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID and chairman of the board for the Coalition for Trust in Health and Science. Good morning, Dr. Tuckson. How are you?
I'm great, and thanks for having us here. Appreciate it.
Appreciate having you. Doctor, as we approach the holiday season, what do people need to know about protecting themselves and their loved ones from COVID-19?
Well, we're aware that there are a lot of respiratory diseases circulating around, whether it's the atypical pneumonia, RSV, the flu, or whatever, even as we're discussing now, including COVID. So we need to be prepared to prevent disease. The holiday season and colder weather means more intimate indoor contact, and that means viral diseases like COVID spread more easily. Our coughs and our sneezes can transmit particles more easily. And unfortunately, COVID hasn't gone away. The virus continues to mutate and people are getting sick and dying. So I'm pleased to partner with Moderna to help inform people as they make their personal COVID vaccine decisions. And here's the key. The overwhelming majority of health professionals and scientists think that everyone 6 months and over should get the updated COVID vaccine now before the holiday season begins.
Very interesting. I got people I know who still don't believe in COVID, but that's another story. How long does protection from COVID-19 vaccine typically last?
Well, we've had experience with more than 655 million doses administered, and the data is clear that the vaccines are both effective and safe, preventing hospitalizations and deaths. But we also know that the vaccine protection starts to wane over time. And we also know that the virus has continued to mutate. So based on what we know, these vaccines should last for 6 months. Special note, those 65 and over and those with moderately or severe immunocompromising diseases should get with their health professional. They may need to have more frequent doses than the rest of us, but 6 months is what the guidance is.
So if I had COVID-19 this summer, do I still need to get the updated vaccine, or will the antibodies I built up fighting that off carry me through the winter season?
Well, the simple answer is yes, you do need to get the vaccine, and here's why. Even though you've already had it, you are still open to getting COVID again as those antibodies from being ill start to wear off. We want to protect you all the way out through the end of the season of the winter season. So it's recommended that you get vaccinated 90 days from when you first received your positive COVID test, or 90 days from the start of your symptoms. But absolutely, the answer is yes.
Now, who is considered most at risk for severe symptoms and outcomes from COVID-19?
The saddest thing to me about this COVID pandemic and now the epidemic is that those who are 65 and over are so severely affected. We know that 60% of all the hospitalizations are in those 65 and over. And last year, 90% of the deaths in the United States were in this over 65 population. So that's the real key. But let me also remind you that 3 in 4 adults in the United States have an underlying health condition which compromises their immune systems. These are things like diabetes, obesity, chronic heart, kidney, lung, and other diseases, people undergoing cancer treatment. And so they need to be in consultation with their personal healthcare provider to see whether they need more frequent doses than the rest of us.
Here's a question I'm really interested in. What is long COVID, and does getting the vaccine protect us from long COVID?
This is there's a definite reason why it's confusing to you, because the COVID virus is really attacks so many different parts of our bodies, and it manifests itself in so many different ways in different people. So if you're one of the people, 1 in 5 Americans who have had after having had their infection, have had symptoms of other problems for 3 months, things like brain fog, fatigue, exhaustion, chest pain, other things. If those have lasted for 3 months after your infection, you have what's called long COVID. Now, what's the best way to prevent long COVID? Don't get COVID. What's the best way not to get COVID? Get vaccinated.
Now, where can we go for more information?
I suggest you go to vaccines.gov. Very simple, vaccines.gov. Another site is disease.education/finder. Disease.education/finder.
Dr. Tuckson, thank you so much for joining us on Morning Blend. I really appreciate it. Of course, we already know that during real COVID, when we had it back in 2019, 2019 and 2020, minorities and really had a problem with other doctors diagnosing and treating.
Well, the good news is that what we found out for the first time in history is that the Black community, because we got mobilized by our Black physicians, our pastors, our social and civic organizations, all of us coming together for the first time in history, we closed a health disparities gap with the rest of America. And what most people don't realize is because we in the Black community followed the guidance and advice so well that our disease survival the second year in the pandemic was better even than white Americans. So the bottom line is, for the Black community, get moving, get involved, get vaccinated. We have already proven that we can save our own lives.
I like that, Doctor. Thank you for joining us on Morning Blend.
Thank you.